Hello and TGIF to everyone. Welcome to everyone to another episode of Makati Medical Center's Health Podcast, where all of us can learn a thing or two about taking better care of ourselves. This is Doc Gia Sison, and it is my pleasure to be with everyone again through this platform. So please share widely para lahat tayo matuto. So for the month of August, our focus will be on our skin. Entitled Skincare, Skin Health, how holistic upkeep improves overall skin condition. We will be talking about our skin and why it needs to remain healthy, and of course yung ways kung paano ito maging hindi ma-damage in the process. And finally, with me here is our guest doctor this month, MakatiMed Dermatology Specialist Dr. Margarita Isabel Tanchiong, or we can call her Dr. Mitch. So hi Mitch, thank you for joining us today.
Hi, Dr. Gia. Thank you so much for having me. It's a pleasure to be here. And hello to all of our friends who are joining us live over Facebook. I'm so excited to share it this afternoon with you.
Yeah, madaming tips ito si Doc Mitch. So let's get ready to start answering the questions.
Okay, let's do this.
So our first segment is about basic skin health. So Mitch, the question is, if you can compare our skin to something else, which would it be and why? Like, kung makakabigay ka agad sa atin ng idea on how sensitive it is or anong klaseng care ang kailangan nito.
What an interesting question. So I think our skin is similar to a house. Okay, so the skin is the outer layer, the scaffolding, and everyone living in the house is, of course, our inner organs. So the skin has the function of keeping all of the bad things out from going in. Syempre, ayaw natin na may magnanakaw or anyone entering. So just the same, the skin keeps our viruses, bacteria, fungus away from our body. And at the same time, it also prevents things from going outside. So syempre, we don't want our kids to go out in the streets and all. So that's just the same, it keeps our organs intact and it makes sure that everything is functioning properly.
Yun. It's actually the largest organ in the body, di ba?
Correct.
So yan, may pa-trivia kami ni Mitch sa'yo. Sa inyong lahat. So, before I continue, please share this stream guys, no, para at least everyone can learn. So question number 2, Doc Mitch, how does the skin change as we age? And is it different ba siya sa men and women?
So the skin changes both intrinsically and extrinsically.
Okay.
No? So intrinsic are the things that really happen over time. So over time, of course, our skin loses elasticity, we lose some collagen, we also lose some fat, some bone, and it's these changes that cause the sagging of the skin, the wrinkles, and the creepiness in skin texture. No? So this happens males and females, and it happens over time. But there are extrinsic factors that affect the way we age. No? Most common of which is, of course, our sun exposure. No? So sun is really something that will accelerate our skin aging. Aside from sun exposure, it's also our activities and whether we smoke or not. No? Smoking is unfortunately not so good for it's not so good for our lungs, also not so good for our skin. And in terms of male and female differences, of course, men's skin is generally thicker, a little bit tougher, and of course hairier. So as a result of shaving and other depilatory motions that men do, there are also some differences in the way their skin reacts as compared to women's skin.
Ayun, so it's parang iba-iba yung texture and the thickness, no?
Yes.
Speaking of change, ano usually yung age, Mitch, ng when we have to start, medyo taking that extra effort in taking care of our skin? Like for females, ano ba yung age na crucial na mag-start mag-moisturize or etc.?
So the earlier we start, the better, because it's so much easier to prevent signs of aging and signs of UV damage rather than to correct. So even my kids who are still in grade school, I encourage them to already use sunscreen every day. So even just that alone, that's good. And then of course, if your skin is a little bit drier, it's we encourage moisturizing the skin.
I love it. Moisturizing is key.
Yes.
Now, next question. We have different skin types, as you mentioned. And this means we have different needs also as well. But despite these differences, what common triggers sa balat naman do all of us share? First, let's talk about our environment in itself. For you, Doc Mitch, what are the top 3 environmental triggers for skin breakouts?
Of course, number one would be the sun.
So,
So really sun damage. Number two would be um, smoking.
yeah.
Smoking is bad. Three, environmental pollution and
Yes.
diet. And another trigger that we cannot also sometimes we cannot prevent is genetics. So there are
Yes.
unfortunately some skin conditions that are genetically predetermined.
You mentioned something about exposure to sun, and we all
Right.
know direct exposure can be harmful. And I'm going to talk about sunscreen naman, no? What's the minimum SPF that we should apply at least every day?
Yeah, so we encourage people to apply SPF of at least 30.
30.
Yes, and what's important because SPF is a measure of UVB, so that's the part of the
Right.
spectrum that causes burning. But then we need to apply a sunscreen that is broad spectrum, so it's something that will protect us from the UVB and the UVA rays as well. And aside from just the number, no, the SPF, what's important is how we apply sunscreen. So usually we recommend applying it at least 30 minutes before we step out.
Oh,
Yes, so
okay.
we need to give it time to work. It's not that when
Right.
you were already,
Alabas
about
agad.
yes,
Oh, okay.
about to apply, it doesn't work that quickly. And also, what we oftentimes forget is to reapply sunscreen. So
Yeah.
oftentimes we just put it in the morning and then we go throughout the whole day. When we perspire, when we do activities like getting wet, our sunscreen wears off. So we need to reapply.
Oh, okay. So dapat lagi may baon na sunscreen
Yes,
talaga,
that's
no?
right.
Before I continue, hello to Mirza, who's watching right now. Hello, and thanks for sharing the stream. Okay, so we talked about triggers earlier, Mitch. We talked about environmental triggers. How about lifestyle?
Of course, so lifestyle is also another factor that contributes to our skin. So, for example, let's say you have a very very active lifestyle, no? So usually I always ask that to my patients. No, example for a golfer or a
Yes.
biker. No? So let's say golf, always having sun exposure. So we really encourage being very good about UV protection.
Right.
The bikers naman, on the other hand, since they often wear a lot of headgear,
Yes.
so these are the patients who often come in with, they kind of look like pimples on the scalp. So what they do, their activities promote this bacterial flora from happening.
Right.
So encourage bacterial flora on the scalp, and that's what causes that skin condition naman. Also, there are occupational hazards
Yes.
also, no? So, for example, let's say, people who work in construction or people who have or who work with a lot of, let's say, chemicals. These are often potential irritants to the skin. So if your skin barrier, let's say if you already have eczema and then you work with a lot of chemicals, these chemicals can potentially be more
Aggravated.
irritating, yes,
Yeah.
to the skin. So you really have to make sure that our skin barrier is well preserved.
That's right. And skin barrier not only includes sunscreen, but it has a lot. May mga PPEs. I'm sure lahat tayo familiar na sa PPE
Yes.
after COVID. Now, so that's environmental, check, lifestyle. And how about product and treatment related triggers?
So a lot of a lot of products have active ingredients. And these active ingredients can potentially cause a flare, especially if your skin is sensitive or very dry. No? So, like for example, one of the most popular skin products out there is retinol.
Yun.
No, so
What
yes,
about retinol? Biglang na-trigger.
Yes. So
What about
retinol is
retinol?
such a great product. No? It's great for photo aging. It also helps with acne, but it can have the potential to be irritating. So sometimes when you start using products with retinol, your skin gets a bit reddish, dry. It can flake out a bit. No? So these are irritants, But it doesn't mean that just because you're having these reactions, that doesn't mean that you have to stop using the product right away. No, so usually what we do is we build up tolerance. We start first maybe twice a week, then increase
Ah,
as
not every day
tolerated. Not
agad.
every day agad, yes. And of
Ah,
course, if your skin is also very sensitive, sometimes we put moisturizer first, and
okay.
then the active ingredient, and then moisturizer again. So parang sandwich.
And then,
No?
like how many minutes in between ang pag-apply, Mitch?
If you're doing the sandwich method, ideally I say about 2 minutes in
2
between,
minutes in
just to
between.
give the skin enough time to absorb
Right.
the product.
Right, kasi nauuso yung retinol eh. So,
Yes.
ayan na. Start muna twice a week.
Yes.
Or patch, parang maybe do
Well,
a
we
patch.
can do a patch test too, but then the skin on the face is a little bit different from the skin on
Ay,
our
oh,
arms.
yun. So,
So
where should we test kapag i-apply sa
usually if
face?
we don't want to, let's say you're going to have a big event the next day
Yeah.
and you don't want to test it right
Yes.
away, maybe test it here along the jawline.
Here,
So at least
jawline.
if there is a bit of a reaction, we can cover it right away.
Yun.
Yes.
Nice, nice. Okay, next question is, what are common skin conditions na that's bound to happen? That's parang medyo out of our control, if I may term it that way.
Okay, so I guess the most common skin condition we see in our clinics is still acne.
Yes.
No? And some people come in, they say, I wash my face every
Mhm.
day and I'm breaking out. I'm so unfortunately, it's something that can happen regardless of your hygiene, and it's really multifactorial. No? So there's
Yes.
no one particular reason why we break out. So genetics has something to do with it, hormones
Yes.
as well,
Mhm.
diet also, lifestyle triggers, as you mentioned. So those are all reasons why we get acne. Another common one is eczema. So
Eczema,
yes,
yeah.
or atopic dermatitis. So usually these patients have a familial predisposition, some family history of the eczema or asthma or allergic rhinitis, and in these patients, the skin barrier does not work as well as
Yes,
the
that's true.
normal population. So moisturizing is really quite important. It's actually the cornerstone of treatment for that.
So interesting, no? So that's both acne and eczema.
Yes.
So we see a lot, no? Mitch, in your practice, when we talk about acne, what's the most common age range that you see in the clinic?
Interestingly, there are two age ranges. So we see the usual, the adolescent acne, the one that our parents used to tell us, oh, that's part of growing up.
yeah.
Yes, but there's also an increasing number of patients with adult onset acne, and usually that's when they break out here, no, on the U of the face. And
So
that's
here.
oftentimes really hormonally mediated. Unfortunately, it's a little bit more resistant to treatment, but there, of course, as long as you have a good conversation with your dermatologist,
Right.
we can find out ways and means to help you out with that.
Always consult with your doctor kasi ang
Yes.
dami dyang skincare products that are
That's true.
for sale, everything. So, on the contrary, what are skin conditions naman, Mitch, that result from lack of proper care and therefore it actually can be prevented? Example, we have been mentioning sunscreen a lot, and we
Right.
all know that sunscreen can actually be contributory to avoiding skin cancer. So, ano yung mga skin
So
conditions?
definitely that's one, a skin cancer. So we oftentimes think, oh, we're living in the Philippines, we have a little bit more pigment in our skin.
Yes.
We're never ever going to get skin cancer. That's really a fallacy.
Yes.
No, there's an increasing number of we've been diagnosing a lot more skin cancer among darker skin population.
Which is a parang change.
Yes, that's right. Maybe I guess we're also more aware.
Yeah.
So we're able to diagnose better now. So really, if you are good about sun protection, then you will lessen the chance of having skin cancer. No? So that's a very important one.
Yun, no? So let's avoid that. So, again, this segment has given us an overview of the basics. Basics pa lang yun, guys, of the skin. And even if it is different for every person, still, no, it can happen. So thank you for everything you've shared so far, Doc Mitch. And now that we've laid down the foundation, let's now build upon it and learn what we can do for our skin so it becomes healthier. kanina, we have been talking about different concerns, etc. And when it comes to our skin, we really want to achieve that clear skin. So this is why, in behalf of everyone, let me ask you this, Mitch. What would you describe as healthy skin naman? And is it possible that despite what people would consider imperfections, that walang perfect, their skin is still considered healthy? What do you usually look at and say that, okay, you have healthy skin?
Okay, so healthy skin is generally skin that is uniform in texture,
Mhm.
with as few imperfections as possible, meaning not too many dark spots, not too
Yes.
much pigment, not too much acne, not too many lines or wrinkles,
Mhm.
skin that is well moisturized and not flaky. So
Yun.
these are generally things we look for, but it doesn't mean just that, once in a while if you break out, you get a pimple. It doesn't mean your skin is not healthy, because it's still normal for us to have these imperfections.
You're right.
And I think we see so much like on social media, people have really flawless
Glassy.
and glassy skin. Unfortunately, that doesn't really
Mhm.
exist. No? So I think what is really important is to love yourself, to love your skin, and to
Right.
be kind to your skin.
Yun, ganda no, no? Self-care pa rin. And
Yes.
no one's perfect, no? Anyway, hi to Ray who's watching. I know you have a question pero mamaya natin sasagutin yan sa Q&A. So, though the skin changes, sabi mo nga, Mitcha, it changes naturally over time. What can you suggest as, let's say, conscious choices that a person can make to ensure our skin remains healthy all throughout?
Okay, so first, no, things that we can put on our face. So regardless of your skin type, whether oily, dry, whatever, oily, dry, combination, sensitive.
Yes.
So important first to cleanse your face, no, twice a day,
Mhm.
to protect your skin from the sun. So by putting sunscreen, and of course moisturizing your skin. And then you need to find out, what is it ba? What is your main concern with your skin?
Yeah.
Is it acne? Is it pigmentation? Is it wrinkles? No, and then when you know what your concern is, then you need to find what product will work well for your skin. So, for example, your concern is, let's say, pigmentation. Then we look for skin brightening products. No? So
Yes. Ah,
that is the
okay.
treatment part. No? So that is for the things that we can put on our skin.
Yes.
But aside from what we apply, what's important also is what we how we take care, how we what we eat, what we drink, and our lifestyle choices. So generally, food that are not so good for our body are
Mhm.
also not so good for our skin. So we try to lessen food with a lot of sugar, um, fast food, I'm sorry,
Hala.
food with a lot of preservatives, and of course, we try to increase our water. So
Yes,
drink a lot of
hydration, no?
water. Yes, it's
Yeah.
very important for our skin.
Nice. Ang daming learnings. But before we continue, a little bit of a promo muna, no? So we have our
Mhm.
flawless summer promo. Alam ko hindi na summer, but still our Skin and Laser Hub is in fact offering up to 20% discount on non-invasive skin and body anti-aging treatments. So this promo is only until next week. So guys, tara na. August 15. So if anybody is interested, do schedule your appointments as soon as possible. For more details, about this, it can actually be found on our Facebook page at I am MakatiMed, and it's one of our pinned posts, so you can see it easily. So, in relation to this, Doc Mitch, what advice would you give our viewers naman when it comes to making responsible choices related to seeking skin treatments?
Okay. Um, Try to let go of the feeling of FOMO. Okay,
Oh,
so there are so
yun.
many, there's always a new TikTok, a new trend
Yes.
about skincare, but it's best to do due diligence. So find out what exactly are the ones that really work for your
Right.
concern. No, and I think the maybe my best advice is to get professional help as soon
Right.
as you can, because definitely your board certified dermatologist can really help you manage your skincare concerns because um, sometimes aside from as you mentioned earlier, aside from the topicals, the things we apply,
Mhm.
there are also maybe procedures that we can do to help improve your skin concern. And as you mentioned earlier, it's holistic, no? So aside from the
That's true.
medication, it's also the non-pharmacologic interventions that can help you achieve your best or healthiest skin.
Yeah, and to add to that, consistency is key
Yes.
also. So it's not like you moisturize today, tas bukas wala
Right.
na, di ba?
I oftentimes tell my patients na skincare, it's like a gym membership. No?
Mm-mm.
So if you avail of gym membership and you only go once or twice,
Wala
no,
rin.
it's not going to happen.
Yeah,
But if
that's
you're
true.
consistent and you do your routine every day, and then definitely the changes will be seen over time.
That's true. Now, the usual advice naman, Mitch, kasi when it comes to choosing skincare products, is making sure these match our skin type. Kasi iba-iba yung skin types natin. Is that the only factor that we should consider? Or dapat ba age, gender, and lifestyle?
Yes, definitely. So, for example, let's say you have oily skin. Usually, we recommend products that are oil-free,
Yeah.
non-comedogenic,
Mm-mm.
and then we
And those
like
are in the labels,
yes, those
Read
are the
it.
labels, and then we usually like gels rather than heavy creams or ointments. No, so and then if your skin is on the drier side, we like the ones with more ceramides, more lipids on the products to keep them better hydrated. No? So
Yan.
yeah, so
Ceramides and lipids. Medyo
yes,
na, pag nakikita ko yan, parang na-intimidate ako. But they're so,
moisturizers.
yeah,
Yes.
moisturizers pala yan. So, galing. So, again, by holistic upkeep naman, we mean the kind of skincare which combines the use of products and daily habits. No? So, kombi siya. What would you consider, Mitch, a holistic skincare regimen naman?
Okay. So, holistic skincare regimen would be something that we're active. That first of all, you have to want to improve yourself. I think so. Oftentimes we say, "Oh, it's my yaya who's applying my products
Mm-mm.
for me." I think what's important is you want to make yourself
Yes.
or
Make
you
it a
want to make your
habit.
skin the best version of yourself. So something holistic would be a proper skincare regimen. Also, the cleansing, the treating of your concerns, protecting your skin from the sun, and the moisturizing. That one. Two, having a healthy diet.
Mm-hmm.
Choosing vegetables, fruits, fresh
The things we
seafood.
eat.
Yes, things we eat. Three, things we drink. So I always say increase water and try to avoid drinking our calories because there are
Yeah.
so many sugary sweet drinks that are not so good for our body and not so good for our skin. Four, have a active lifestyle. So
Yeah.
find there's so many options out there. Whether your passion is yoga or Zumba or basketball, having an active lifestyle is also does wonders for your skin.
That's true. So that's holistic kasi everything is addressed. And of course, the way you see yourself, di ba?
Yes.
Parang it's already
Again,
holistic.
self love.
Self-love. Okay, Doc Mitch, I hope you're ready because we've received quite a number of questions from our Facebook followers prior to this podcast, and we're receiving more today. And okay, let's start with the question of Ray. So, hi doctors, what is the difference between skin tags and skin warts?
Okay, so both of them are actually benign growths in the skin.
Mhm.
But skin tags are not viral, skin warts are viral. So
Yun.
skin tags, they like areas on our body that sweat a lot and areas where we have folds. No? So they like
Mm,
here the sides of the neck, the
that's
underarm,
warts.
those are skin tags.
As
The
tags,
tags,
okay.
so and also the inguinals. Warts actually also same areas of
Mhm.
predilection, but they are viral. And for both, we recommend removal cautery
Removal.
usually, yes.
And most of the time, it's
Most of the time it's
cautery.
cautery.
Ah,
But there are
okay.
some lasers that also can be used to remove these benign growths.
Okay, so that's the difference between tags and
Warts.
warts. Okay, so from Francesca Dominguez, how to lighten and reduce pimple marks?
Okay. So of course what you want is to avoid pimples so we'll not have pimple marks. But if they're there
Yes.
already, usually we of course sun protection and it's a multi-modality treatment. So we give creams to help lighten
Mhm.
up the marks. And in terms of treatments, we can do a combination of chemical peels and pigment lasers to help lighten up those unwanted spots no, on their face. Pimple marks, sometimes they're just color changes, but sometimes they are a little bit they're indentations
Yes.
in the skin. No? So for those, especially for the indentations in the skin resurfacing lasers would really be helpful in making those marks go away faster.
Ayun. Okay. Ah, yeah, the skin resurfacing laser.
Yes.
Okay, from Patricia Barakel, how to remove dark circles and deep blackheads po?
Okay. So unfortunately, dark circles, it's usually something that you got from your parents or some it's usually
Ah,
genetically predetermined, and if you
okay.
have a history of eczema, you're fond of rubbing your eyes,
Mm-mm.
those contribute to the dark circles of the skin. So there are creams that we can give oftentimes with vitamin K, with caffeine, which help mask the darkness underneath the eyes. We also have a pigment laser. It's called the Star Walker. It's an Nd:YAG
Oh,
laser.
we have it
Yes,
here.
that's specific for the we call it the panda eyes.
Yes.
So that can be used to lighten those spots. For the blackheads that you mentioned earlier, usually it's a retinol that would help. So any form of retinol, whether the medical grade ones, the tretinoin or and adapalene or tazarotene, those are the prescription strength. Those are the prescription retinol
Mm-hmm.
versus the retinol cosmetic.
Yes.
Those would be the best way to remove your blackheads.
Yon. Now we have a question from RD Lopez. Hello, RD. So, what is the correct sequence of putting creams, serums, toners, moisturizers? Ano ba yan? May step one.
All right. So there's no hard and fast rule
Okay.
really, but then there's, I guess, a logical way on how to do it. So basic rule of thumb is to use the lighter ingredients first and then the thicker ones in the end. So in the
Mm.
morning, for example, so it would be washing your face with the
Mhm.
cleanser, putting the toner, and then the serum, and then the moisturizer, and then your sunscreen.
Oh. Ah,
Yeah.
lasty sunscreen.
Lasty sunscreen in the
Oh,
morning.
first.
Yes.
Wala, wrong.
Last. Sorry. And then, oh, but
Okay.
I forgot also, if you have, let's say, an active ingredient that you're putting, so that would be also maybe before the moisturizer. Because, of course, if you put the moisturizer already, that active ingredient that you're putting might not work as well because the moisturizer is already
Right,
there. No?
right.
So let's say you're putting benzoyl peroxide for acne.
Mm-mm.
Usually I recommend to put it so wash, toner, serum, benzoyl peroxide, moisturizer,
Moisturizer.
sunscreen.
Ah,
Huh?
talagang lasang
Last ng
sunscreen.
sunscreen in the morning. And
Okay.
then of course at night, no more sunscreen.
Okay.
Yes.
Gets. Nice. So, okay. Mali pala ako.
Sige,
Okay,
we
so
will revise your
we will
regimen
yes.
later.
Okay, thank you. So from Lalaine Palero, how to avoid face warts?
Okay, so usually we are more predisposed to getting warts when our immune system is compromised or is down. So oftentimes, it's patients who after pregnancy, that's when they
Mhm.
come in with a lot of warts on the face. So I guess the best way is to boost our immune system and try to use your own products, no, your
Yes,
own
agree.
towels, your own makeup tools. If you can do that, that would minimize the chance for you to get new warts
Right.
on the face.
Kaya it's important to wash it well, no?
Yes, of course.
Basta use your own. Now,
Yes.
this is from Christine Wilmarie Belaro. Any home remedy for eczema?
So most important about eczema is really to keep your skin well moisturized. No? So of course there are so many great moisturizers out in the market, but to me, I think what's most important is you find something that you like to use.
Yes,
No?
true.
So as you mentioned earlier, consistency is key.
Yes.
We can give you a fancy moisturizer that's available outside, but
Mhm.
if you won't use it, then it's not going to work. So find something that you'd like to use.
And find something
Uh,
that works for you
find something that
also.
works for you,
Yeah.
definitely. Yes.
And from Diana Bombales, what do I need to use to remove dark spots from atopic dermatitis?
Okay, so it's a bit of a challenge now because we oftentimes give skin brightening products to of course, to brighten the dark spots. But for patients with atopic dermatitis, their skin barrier is a little bit compromised.
Right.
So these set of patients are more prone to getting irritation from the lightening products. So oftentimes for my patients with atopic dermatitis, I suggest lasers
Yes.
for pigment lasers for lightening their dark spots, since um, there's less of a chance that they would develop an irritation from the products, since it's a laser that's being used.
Ayun. So again, consult your dermatologist.
Yeah.
So another question, this time from Claudine Balmonte Sonajo or Sonajo. Oil control product recommendations, please. Since we cannot recommend products, Dr. Mitch, ano na lang ang advice mo on how people with oily skin rather keep the sebum under control?
Okay, so usually we recommend products with alpha and beta hydroxy acids to help reduce the oil control. I tend to recommend beta hydroxy acid, which is a salicylic acid. It really helps to exfoliate and that way reduce oiliness.
Okay, so read the ingredients.
Read the ingredients,
So from
yes.
Neris Canubas, how long do I need to use Cleanse It CMS?
So this product is actually composed of two main ingredients: adapalene, which is a retinol, and clindamycin, which is an antibiotic. Since it has an antibiotic, even though it's just topical, I personally don't like having patients on it for more than 3 months,
More than 3
because we
months.
don't want to develop resistance to the antibiotic. But the adapalene, which is the retinol component, may be used long term.
Yun, okay. And speaking of skincare for pregnancy, we received two questions naman, Mitch. One was from Lynn Antoinette. What is the best skincare routine during pregnancy? And then the other naman from Catherine de Macali Hampton. Pregnancy skincare for dry skin but acne prone and a lot of dark spots, to cover both. In general, Dr. Mitch, what would you advise pregnant women when it comes to their skincare routine? I think yun talaga yung main
Okay.
question.
Actually, first, congratulations. Pregnancy is definitely a very exciting time in any person's life. No? So, unfortunately, there are a lot of products that have not been studied well, because when you're pregnant, we don't want to
Yeah.
test products on you. So it's important, of course, to, again, still the same, to cleanse, to keep your skin well moisturized,
Yes.
to protect your skin from the sun. But as you mentioned, if you have some acne issues, usually azelaic acid is a pregnancy category B, so that's something that can be used safely during pregnancy. Benzoyl peroxide is also safe for our patients who are pregnant, and some topical antibiotics like erythromycin and clindamycin may be used safely as well.
Ayun. So I hope that helped your questions. And lastly, we have Mosho Hernandez. Can you rank all retinoids for persistent acne?
Okay,
Paano
there,
lang, basic.
yeah, there are topical retinoids, but if, as you mentioned earlier, you have persistent acne, no, so you may wish to consider an oral retinol, which is oral isotretinoin.
Right.
So that is an oral vitamin A medication that addresses all of the reasons why we have acne. So I guess that would, in terms of ranking, that would be the strongest, or
Number
the
one.
most potent, or the one with the best evidence. And then in terms of the topical retinoids that we apply, the ones that are usually prescribed are generally, because get some retinoids get broken down first before they're able to work in the skin. No? So in terms of potency, I would say tretinoin would, and there are different strengths of tretinoin. That would be the most potent for the topicals. Adapalene and tazarotene would probably be next, and then the retinol and the
Retinol.
retinaldehyde would be
Ayun. So
less irritating.
less irritating. Yun, so thank you for your questions, everyone. We hope we were able to answer them well. Thanks so much, Mitch. Wrap things up, Dr. Mitch, is there anything you want to add or emphasize? But it's a general advice for everyone in terms of skin.
Okay, so I think I will go back to what I mentioned earlier. And really, each person is unique.
Mhm.
We all have our own unique skin texture, our own skin issues. We all have some degree of pigmentation,
Mhm.
some degree of acne, some degree of lines and wrinkles. And what's really important is to learn to be kind to our skin, to
Yes.
be kind to ourselves, and to love ourselves despite our imperfections, because that's what makes us who we are.
Nice.
Mhm.
So, well, that's about it for this podcast, everyone. So, see you on our next episode. If you have topics that you want us to discuss, please do let us know and we will consider them. Do follow our official Facebook page and Twitter pages at I am MakatiMed to get the latest updates from MakatiMed, and also visit our website at www.makatimed.net.ph. So, guys, see you again next month and stay safe.